Transgender people, breast cancer and hereditary cancer. For many transgender people, breast cancer screening can be a concern, especially if the process is at odds with their gender identity. They may be concerned about experiencing discrimination at the screening facility, or that a mammogram might be uncomfortable or worrisome. In general, a screening examination should be performed when a person has a body part at risk, for example, breast, ovary, uterus, or prostate, and meets current screening criteria according to risk factors or symptoms. Breast cancer risk in the general population and screening options. Transgender men who have not undergone bilateral mastectomy or breast reduction should follow current screening recommendations for non-transgender women. Individuals under 50 years of age should practice breast observation and promptly report changes to their healthcare providers. Those between 50 and 69 years of age should have a mammogram every 2 years. Currently, there are no clear recommendations regarding breast screening for transgender men who have had a mastectomy. Surgeries that preserve more tissue, such as those that leave nipples intact, also represent a higher risk of breast cancer. However, the risk of breast cancer in the breast tissue remaining after a mastectomy is unknown. Discuss the best screening option for your individual situation with your healthcare provider. Practice breast observation and promptly report any changes to a healthcare professional. For transgender women, taking feminizing hormones such as estrogen for more than 5 years increases their risk of developing breast cancer. Individuals under 50 years of age should practice breast observation and promptly report changes to their healthcare providers. Those between 50 and 69 years of age should have a mammogram every 2 years. You can have a mammogram even if you have breast implants. If you are a transgender woman and have never taken feminizing hormones or have been taking hormones for fewer than 5 years, you do not need regular screening. Breast density. Dense breasts contain more connective tissue, glands, and ducts than fat tissue. Women with dense breast tissue have a higher risk of developing breast cancer than other women. Breast density can only be seen on a mammogram. Transgender women are more likely to have high breast density, which increases their risk of breast cancer. Special consideration: family history of breast cancer. Just like for non-trans women, for a transgender person with a family history of breast cancer, physicians may consider screening by mammography or magnetic resonance imaging at an earlier age, reducing the number of years of exposure to feminizing hormones or increasing the frequency of screening. Hereditary cancer. Any transgender person with a family history that suggests a genetic predisposition to cancer should be referred for genetic counseling. Any transgender person who is a carrier of a genetic variant associated with hereditary cancer or whose family is known to have such a variant should be referred for genetic counseling. If you carry a pathogenic variant in a cancer predisposition gene, discuss your management with your physician. Guidelines are available to determine what screening or risk reduction options are available to you, at what age you should start, and how often to do them. For more information on the subject, refer to the video clip on management options for hereditary cancer. For example, to manage breast cancer risk, mammography or magnetic resonance imaging, or MRI, can be started as early as your mid-20s. Transgender men who are BRCA carriers and who have not had their ovaries and fallopian tubes removed have an increased risk of ovarian cancer. Ovarian cancer is particularly difficult to detect. Even with increased screening, ovarian cancer is often not detected until it is in an advanced stage. Prophylactic bilateral salpingo oophorectomy, the removal of the fallopian tubes and ovaries before cancer develops, reduces the risk of ovarian cancer by approximately 96%. Transgender women who are BRCA carriers have an increased risk of prostate cancer and should be screened accordingly. Knowing one's genetic status, carrier or non-carrier, can also change the options for gender reassignment surgeries. For example, for a BRCA carrier transgender man, mastectomy that leaves very little breast tissue may be recommended to reduce the risk of breast cancer.